In this recording, I will cover Chapter 14, Periodontal Diseases. Today we will be talking about periodontal disease and the structures of the periodontium. We'll identify conditions linked to periodontal disease. We'll define calculus, supragingival and subgingival calculus, and gingivitis and periodontitis. We'll also look at some of the signs and symptoms of periodontal disease. And finally, we'll look at the periodontal staging and grading system for periodontitis. So what is periodontal disease? Periodontal disease is an infectious disease involving the inflammation of the structures of the periodontium. Periodontal disease is the leading cause of tooth loss in adults. Almost 75% of American adults have some form of periodontal disease, either gingivitis or some stage of periodontitis. Often they are unaware they have the disease. Fortunately, with the early detection and treatment of periodontal disease, most people can keep their teeth for life. So let's look at the structures of the periodontium. The first structure is the gingiva or the gums. So it's this area right here. It covers the alveolar process of the jaws and surrounds the neck of the teeth. There is the free gingiva, which is this area right here that surrounds the tooth, and then the attached gingiva, which is this part of the gum tissue. Then there is the sulcus, which is the space between the tooth and the free gingiva. So here is the sulcus right here. Then there is the cementum, and this is what covers the root of the tooth, and then the alveolar bone that supports the tooth and the jaw. Then there is the epithelial attachment, which is the tissue at the base of the sulcus where the gums attach to the tooth. And finally, there's the periodontal ligaments, which is this dense connective tissue that connects the cementum to the alveolar bone of the socket wall. There is a systemic connection between periodontal diseases and chronic diseases. Periodontal disease may significantly affect health conditions such as heart disease, stroke, or preterm birth. The converse is that systemic diseases like diabetes and respiratory disease can contribute to periodontal disease. Individuals with severe periodontal disease have 3 times the risk for stroke and 3.7 times the risk for coronary heart disease compared with individuals without periodontal disease. The association with preterm low birth weight infants may be linked to particular biochemicals that are produced with periodontal disease, such as prostaglandin E2, which may create hormones that cause early uterine contractions and labor. It also appears that bacteria that have colonized in the mouth may alter respiratory epithelium, leaving it more susceptible to pneumonia. What causes periodontal disease? Remember when we talked about biofilm or plaque in Chapter 13? Biofilm or plaque is the soft, sticky substance that adheres to the tooth surface. Calculus provides the surface to which that plaque can attach. There are 2 types of calculus, supragingival and subgingival. Supra meaning above and sub meaning below. So supragingival calculus is found on the clinical crowns of the teeth, above the margin of the gingiva. It is readily visible as a yellowish-white deposit that may darken over time. Subgingival calculus forms on the root surfaces below the gingival margin and can extend into the periodontal pockets. it can be dark green or black. Subgingival is the most harmful of the two types of calculus. Okay, so this is a clinical photo of a 10-day-old supragingival biofilm. The first symptoms of gingival inflammation are becoming visible. So you can see them right here. The biofilm cannot be removed by rinsing. What's happening here is the bacteria is producing enzymes and toxins that are starting to destroy the periodontal tissues and lowering defenses. This picture shows heavy calculus deposit on the lingual surfaces of the lower anterior teeth. This is very common to see because this is an area that people sometimes do not clean very well. So the vast majority of periodontal diseases can begin as inflammation caused by the accumulation of bacteria in the biofilm. Periodontal disease can be triggered by other factors such as malocclusion, some medications, and serious nutritional deficiencies. Although bacteria is necessary for periodontal disease to occur, the bacteria is not completely responsible for the destruction of the periodontium. Other risk factors can alter the body's response system to the bacteria. These risk factors will determine the onset, degree, and severity of the disease. As the number of risk factors increases, the patient's susceptibility also increases. You can look at table 14.2 in your textbook, which lists the common risk factors for periodontal disease. Periodontal disease is divided into two types, gingivitis and periodontitis. So let's talk about the signs and symptoms of the two types of periodontal disease. Remember we talked about signs and symptoms earlier. So signs and symptoms include red, swollen, or tender gums, bleeding gums while brushing or flossing, loose or separating teeth that are separating from the gums and the connective tissue, pain or pressure when chewing, and then pus around the teeth or the gum tissue. So these are all signs and symptoms. Okay, so let's talk about gingivitis. What is gingivitis? It's the inflammation of the gums. It is characterized by red and swollen gum tissue and bleeding of the gums. It is important to note that there is no tissue recession or loss of connective tissue or bone with gingivitis. If you look at table 4.3 on page 77 in your textbook, this describes the characteristics of healthy gum tissue and diseased gum tissue. Okay, gingivitis is usually painless, and a lot of times it remains unrecognized until someone points it out to them, you or the dentist or maybe the hygienist. But improving daily oral hygiene will reverse gingivitis. So gingivitis is reversible. Other types of gingivitis include type 1 and gingivitis associated with puberty, pregnancy, and the use of birth control medications. This picture shows gingivitis type 1. Gingivitis is limited to the epithelial and gingival connective tissues. So you can see here is the type 1. This picture shows medication-induced gingivitis. Anti-seizure drugs and hormones such as estrogen and progesterone can cause gingival enlargement. So you can see how here, see how the gingiva are inflamed and swollen. Okay, let's talk about periodontitis. What is periodontitis and how does it differ from gingivitis? Periodontitis is the inflammation of the supporting tissues of the teeth. It extends from the gingiva into the connective tissue and alveolar bone that supports the teeth. Periodontitis can progress to destroying the connective tissue attachment at the apical portion of the periodontal pocket, and apical is the tip of that pocket. Okay, this illustration shows a cross-section of a tooth and associated anatomical structures. Side A illustrates the depth of a normal gingival sulcus. So you can see right here, that is a normal gingival sulcus. Side B illustrates a periodontal pocket. Notice that the calculus is pushing the gingiva away from the tooth. The main area involved in periodontal disease is the sulcus and the pocket between the teeth and the gums. This pocket is pathologically deepened gingival sulcus. And how do we measure that pocket? Usually the dentist or the hygienist will take a probe to determine the extent of the disease. So the higher the measurement, the deeper the pocket, the more severe the disease is. Okay, in 2017, the American Academy of Periodontology, or the AAP, developed a new classification system for periodontal disease. This classification system supports clinicians to form a complete picture of a patient's periodontal condition through staging and grading systems. Periodontitis staging has 4 stages, 1 through 4. These stages define the severity, complexity, and the extent and distribution of the disease. Table 14.1 on page 171 of your textbook has more information about the staging system. Periodontitis grading gives a grade of A, B, or C. Grade A is a low rate of progression, or a slow rate of progression. Grade B is moderate, and grade C is rapid. If you look at table 14.5 on page 179 of your textbook, this has more information about this grading system. Okay, if you have any questions, please email them to me or join me during my office hours on Wednesday from 7 to 8 p.m.